Hi guys. Okay, so I'm going to give you exactly what you need so that you can get your level 2 or your level 3 or whatever it is that your program requires of you on this ATI Proctored Exam. Now, you probably listened or viewed a lot of videos and they told you how they studied and what book they used and all of that. That's great, but I'm going to tell you what you do need to study and what kind of questions are going to be on the test so you can get your level 3 and your level 2, and you're welcome. Okay, so let's get started. This is the book. That was my Bible. It's just a assessment book. I don't know if you can see that. Right? It's an assessment book. The ATI fundamental book was good. I did use that a little bit the first time I took the test. I used that the first time. The second time, not so much, because the first time I noticed that, am I parking retarded? My husband is going to be like, why are you in the driveway acting like you are the only one that live here with your bright orange car, right? So the ATI book really didn't help me all that much. What helped me was this assessment book. This assessment book. It is called Nursing Health Assessment. It's a Davis book by Patricia M. DeLeon. That helped me. Doing adaptive quizzing on ATI helped me. Doing just a lot of practice tests, studying my skills, studying assessments, because the test is basically skills, assessment, patient safety, communication. That is your test right there. Remember, this is fundamentals, is basic. They are testing you on basic things. So if you are in a different class or you took fundamentals last semester, do not call on any new knowledge, because that knowledge is going to make you think too hard on a simple question. Just know patient safety. They want to know if you know how to do a certain skill correctly. Assessment, do you know how to assess your patient correctly and safely? That's what they want to know, and that's what the test is. Some of the questions that you're going to come across, patient safety questions, like they're going to give you a medication. Forget about the medication. Don't even focus on it. They're going to ask you something about allergies. That's the patient safety aspect that they're trying to hit on. Your patient is taking this medication for the very first time. What is your first priority? Or they'll give you a symptom. Your patient just took this new medication and they're complaining of shortness of breath. What is your first priority? And I don't know what they may ask you in the options, but if anything is related to an allergy, anaphylactic shock, or anything like that, that is going to be your answer. You're going to get questions that's going to ask you about a procedure. Forget about the procedure. Who cares? You want to focus on what are they asking you about this, about any procedure. What is the patient safety aspect of it, or airway? If they're talking about patient safety or airway, if airway is not there, it's patient safety. If airway is there, it's going to be the airway. Concentrate on, those are going to be your answers pertaining to airway. Follow the Maslow's, the rule and the law and all of that. No, airway is always first. You are going to pay attention. ACI is really big on numbers, times, days, dates, and all of that kind of stuff. You are going to want to know how often you're going to change an IV tubing, feeding tubing, baggie, thingy. You want to know how often to change things. 72 hours, every 42 hours, what? Know what that stuff is. You want to know the correct centimeters or inches you are going to put a suppository in someone or an enema. They're big on those type of numbers. You want to know how many inches away from the sclera are you going to insert those eye drops. You want to know where to put the eye drops. Are you going to put it up here on this part of the eyeball? You're going to put it down here. You're going to put it directly on the eyeball. They're going to ask, those are your options. They're going to ask you questions like that. They're going to ask you questions about how are you going to put in this ear medication? Are you going to pull it down and back, or are you going to pull it up and back? Adults, remember, they're tall. It's going to go up and back, right? They're going to ask you questions about how to listen to heart sounds. They're going to give you directions. What direction are you going to start? And they're going to give you the pattern. What pattern are you going to use? A lot of assessments, a lot of skills. They're going to ask you about, I just had it. They're going to ask you about heart sounds. Where can you hear a heart murmur? Know that fifth intercostal space mid-clavicular line. You're going to want to know, they're going to give you a recording. You're going to listen to the breath sounds. They're going to ask you, is it normal? You are going to want to know how to position yourself alongside of a patient who has an immobility device. You're going to want to know about that cane, that crutch, that walker. Definitely on the test. Know how far to advance the walker, what leg or what part of the immobility device needs to be advanced first. If it's a cane, how far you're going to put the cane, how many points it needs to be on the ground, all of that. Just know what to do with those cane, walker, and crutches. You want to know how to, okay, so let's go back to patient safety. You want to know about the oxygen. They're going to ask you how many liters. Is it liters? Well, you want to know what to set your oxygen on. Can you put it past 6 if it's a nasal cannula? What number are you going to use? They're going to ask you about, okay, let me just say this so you won't pull your hair out when you see it. Know that ATI has their own special test bank that no one has ever seen before, and you're going to get questions that you have never seen before, topics that you think that you never had before, you may not have yet. Don't freak yourself out over those questions. Everyone has a 50-50% chance of getting those questions right. You're not alone, so don't freak out. Just do the best you can with those questions. It's not a lot, but if you are not solid on your assessment skills, patient safety, communication, getting those questions wrong can kind of do you some harm. So be solid on patient safety, assessment, and skills and all of that. You are going to want to know patient safety. We did the oxygen. You're going to want to know how many feet away from a stove or what is that, fireplace that the oxygen tank needs to be. You're going to want to know what to do with wires that are on the floor. You want to tape them up against the wall. You want to make sure that there are no throw rugs in the way. They do not have to uproot their whole carpet, flooring. That's going to be like a option. Make sure there are no throw rugs, and you're going to want to get those wires out of the way, put them up against the wall, and tape them. What else? So like I said, ATI was big on numbers. You're going to have to know how many milliliters you're going to use to flush medication. They're going to ask you about medication administration when it concerning like flushing it and how you need to give it one by one, things like that. Now when it comes to, they're going to have definitions, and these definitions is not going to go Like, what does this mean? They're going to get, all the questions are scenario based. So you have to know veracity and benevolence and all of that. You're going to have to know what an assault and battery is. They're going to give you a situation. No assault and battery. They're going to ask you, this nurse is over here threatening this patient, telling them they're going to do this and that because the patient is not taking the medication. What is that called? It's an assault. Remember, an assault is a threat. Battery is they're acting out that threat. Know about restraints. Know that you have to take them off one by one if a patient is dangerous and acting violent. That's the answer. Know that you have to renew the order every 24 hours. You have to assess your patient, and I think every 2 hours. No, because I'm clapping because this was like some off the wall question, because you know that we have to turn the patient every 2 hours, right? ATI, they say, they give you these options. I forgot, it's a patient safety question. How do you, something about the patient, but one of the options was turn them every 4 hours. That was the only one that made sense, because you had to turn the patient, and then the other ones was just like some craziness. So just know about patients who are in the bed and they don't get up. Know what to do with those patients, how often you have to turn them, and all of that. And see what the ATI book says, because at work we do every 2 hours, and I just don't remember. Know that there is going to, those weird questions I was telling you about, the ATI have their own little secret test bank. They're going to ask you questions about a false eye. How to clean a false eye, how to take out a false eye, put in that false eye, know what to do with that false eye. It is a select all that apply question, and it's also, I think I got like 2 more questions regarding it. Don't use soap and water, you use plain water. And you have to know how to insert it and put it in, and what finger to use, and all of that. You want to know how to do post-mortem care. That's a select all that apply question. You need to put the steps in order. Know what dressings to use on a wound, not a wound, an ulcer. Know what dressings to put on like a stage 2 ulcer. Know how to clean an incision. They're going to give you a picture with arrows. You have to pick the correct one. Know your tests. Your Snellen test. Know your cranial nerves. Cranial nerve number 5 and cranial nerve number 7. Know, because they're so similar, know what to do for both of them. Cranial nerve number 5, you want to bite down. Cranial nerve number 7, you want to make faces, smile, raise your eyebrows, do things with your face. Okay, you're going to want to know about race, another patient safety question. What to do if there is a fire. They're going to give you a scenario and a situation. You want to know about that. You want to know about your contact precautions. You want to know what needs to be for droplet, what needs to be for airborne. I think it was either measles or meningitis they asked about. Know what kind of personal protection equipment to use when you are cleaning someone who had a bowel movement or who has diarrhea or something like that. Know what else? I'm trying to remember. Did I tell you guys about I think I told you about the tubings. You want to know about that. You want to know about, okay, for some of us, or some of you didn't do anything concerning IV and veins. They're going to give you a question. They're going to throw some vein names at you. Cephalic vein and some other vein. Don't let that scare you. They're just trying to throw you off. Don't pay attention to the names. What you're going to pay attention to is the location, the site that they're asking you to put that vein in. So they're going to give you some sites. You're going to the site that makes more sense is the site that is least annoying to the patient. You're not going to put the IV in the back of someone's hand. You're not going to put it in the arm that they write with, their dominant arm. You're not going to do that. You're going to put it somewhere that it's going to least affect the patient. That's what the focus is. So don't let that question throw you off. Even if you don't know what that vein is, look at the sites, the anatomical sites, find the best one. You're going to want to know about all of your reflex tests. You're going to know the sites of where they test those tests, because they're going to ask you about that. Know what those sites are called, know where they are, and you'll be good on that. Know what a turning fork is and how to use that test. You're going to want to know about the Braden and the Norton scale. They're not going to ask you, they're going to ask you, yes, it's about 2 questions. They're going to ask you about if the number is decreasing or increasing on those scales, what does it mean? You want to know the categories of each test. They're similar full risk tests, but you want to know they have different categories, or different, I'm just going to say categories that they use to test the patient's level of falls, if that makes sense. So you have to know that. You want to know about the nurse's role. They're going to ask you a question. It may not just be this question. It may be a question that's similar pertaining to the role of the nurse. The question I got was about a nurse manager is in the room with a new nurse. What is this manager acting as? Is it an educator? Is it a client advocate? So you know what each of those roles are. Know what to delegate to a CNA, what not to delegate. Remember, they cannot teach anyone anything. They can't assess. They can't do any type of procedures. I think what the one I got was they can do a simple dressing change. Everything else was like a no-no. What else? 16 minutes and 50 seconds. Watch when I close out this camera. I'm going to remember everything. But basically, guys, if you listen to what I'm telling you and study your assessments, study your pulses and stuff, where the pulses are and what you're looking for and what happens if it's diminished or something like that. What do? I'm looking through this book. Study your assessments, study your skills, study your patient safety, study communication. Most of your answers are going to be about clarification. They're going to give you a scenario. What's the best choice is either clarification or you are going to pick an answer like, tell me more about this. Those are going to be your answers. You are also going to have a question about, what was that question? Jeez Louise. It was right there. Oh gosh. Okay, well, I'm not even gonna try to remember. My brain hurts already. So yes, guys, that's what it is. If I remember anything else, I will put it in a description box. I will list them as I remember. The assessments. Please know it. Know your skills. Did I tell you about the trach one? The trach, they're going to ask you a question about a trach. You are not going to use anything with cotton. Also, if the person is on neutropenic, what you're going to do, you're going to, is it the neutropenic or the trach? I think the trach, a couple of questions on that. Number one, it's sterile. You need sterile gloves. What kind of solution to use. They talk about the inner cannula, the outer cannula, something like that. One of them you do not take out because they won't be able to breathe. Just know everything you need to know about that trach. All right, know what to clean it with, what to do, what not to do. Know that it's sterile. Know about your neutropenic person. Know about okay, I'm drawing blanks. That's it. I will put what else I remember down. But guys, if you do what I just told you to do, you can score a level 2 or higher. So you are very welcome, and you will ace your test. Don't stress out. Don't rely too much on the ATI textbook, because it's not enough questions at the end of the chapter to help you, and it's too much information. So if you study your skills, if you have like the skills portion of the ATI, go through those. Go through your assessment book and know the basic head to toe assessment. If you know it by heart and you know why you're doing certain things, you will be good. If you know about the patient safety and how to make sure your there was a question about the patient's gonna sit up, and the answer was you position the chair 45 degrees so that the patient can go ahead and pivot onto the chair. They had, one of the options was 90 degrees. They are big on numbers. So know your degrees, know your numbers, know how far to insert, know your centimeters, your milliliters, and how to do what to use with certain things, then you will be fine. Know the ATI numbers. Do not rely on your textbook numbers, because it's totally different and you want to use ATI numbers. I didn't get any fluid and electrolyte questions. There was one question about lab values, and one was out of order, and it was potassium. It was like 2.9 or something like that. And I think that's it, guys. This video is long enough, 21 minutes. I am done. If I have anything else to share with you, I will definitely put it in the description box. You guys be blessed. Have a good day. Bye.